So good afternoon, everybody. The August gathering. I am really proudly privileged to address the welcoming session on behalf of CAHO, the Consortium of Accredited Healthcare Organizations, as the Vice President of CAHO. And it was indeed a pleasure to talk on a topic which is related to the World Accreditation Day, June 9th. We are celebrating the World Accreditation Day on behalf of CAHO. Because the 9th June 2024 or year-wise, it marks the World Accreditation Day, which is a global initiative established by no other than ILAC and IAFA. ILAC stands for International Laboratory Accreditation Corporation, and IFS is in the International Accreditation Forum. Incidentally, ILAC is directly associated with us because NABL is a MRA of ILAC. And I can remember the accreditation of this country started with our founder, father of quality, Dr. Giridhar Gyani, who is over here. I welcome you, sir, over here. And also the whole program of ILAC initiated accreditation has been taken by QCI of our country, Quality Council of India of our country, where all the national boards, including the NABH, NABL, they are present. I would like to welcome Dr. Atul Mohan Kochar, CEO NABH, particularly. And then I would like to emphasize on the point that CAHO being an integral part of the accreditation of this country's movement. CAHO has taken up the vouch oath for the theme of this year, that is accreditation, empowering tomorrow and shaping the future, focuses on how accreditation can help shape various aspects of our life in our changing world. And that is where I would like to welcome our Secretary General, Dr. Lallu Joseph, to address you, our plans, programs, and my personal gratitude goes to both Dr. Onurada Pichumani and Dr. Subin Setti for organizing such a good program. There are a lot of dignitaries who are going to come over here and have many sessions. I would like to welcome on behalf of CAHO to every one of them. I would now put it an end. Before that, I would like to introduce Dr. Samina Zamindar. Dr. Samina Zamindar is an ophthalmologist. She's a surgeon, ophthalmic surgeon, and she's the CMD of Zamindar Microsurgical Eye Center. Moreover, she is a fellow NABH assessor, and she is also an advocate of patient safety and General Council, Governing Council member of our CAHO. Dr. Samina Zamindar. Thank you, everybody, again.
Thank you, Dr. Shankar Sen Gupta, sir, and a very good afternoon to each one of you. On behalf of CAHO, I'm sincerely grateful to each one of you who have given your 3 hours of time to listen to what accreditation has in store for you. All of us in healthcare, in the business of healthcare, know that we all like to work with systems, but then something goes wrong. Way back in 2005, there was a Harvard business study which said that follow-through of systems is possible only with accreditation. And today you will be listening to experts in quality and accreditation. And our sincere belief is that we want you all to become believers in the magic of accreditation. I have the proud privilege of introducing the experts in the shortest possible time. So the first speaker of today, the opening batsman, is Dr. Lallu Joseph. My personal favorite, a mechanical engineer by qualification turned into a passionate healthcare advocate, a patient safety advocate. She is the quality manager at CMC Vellore and the Secretary General at CAHO. I can very safely say that she has revolutionized the way quality training is perceived in India, and CAHO can be safely called an institution of quality training. Without further ado, Lallu ma'am, over to you to talk to us about role of CAHO, the Consortium of Accredited Health Organizations in accreditation.
Thank you very much, Dr. Samina. And I bring greetings from the Consortium of Accredited Healthcare Organizations. And this is the program that's conducted by CAHO. From the patrons of CAHO and Dr. Vijay Agarwal, our president, and all the governing committee members. It's a proud privilege for us to have all of you along with us to celebrate the World Accreditation Day. Congratulations and greetings to the Quality Professionals Wing, Dr. Anuradha Pichmani, Dr. Subin Shetty, Dr. Anna, and the entire team for putting up this program. And every month they have this CQE series, and that's actually reaching so many people across the country and the globe, and our sincere appreciation to the team for making this happen. So my role is very simple. There are several people here who are going to be talking about accreditation. I'm going to talk about the role of CAHO in accreditation. CAHO, the Consortium of Accredited Healthcare Organization, was set up in the year 2013 by our founding members. Dr. Giridhar Gyani, sir, is here with us, Dr. Alexander Thomas, and all our patrons who have been instrumental in setting up CAHO. CAHO was set up to promote quality, patient safety, and accreditation. So accreditation is part of the DNA of CAHO. So we believe in accreditation, the basic minimum standards that need to be implemented in the hospitals. When CAHO was established, it was clearly put together as an organization that would become the sounding board for the accreditation agencies and to build capacity in the country. We realized when the NABH accreditation started and hospitals were embarking on this journey of accreditation that we needed to build capacity in the country because hospitals did not have the capacity to take this journey forward. And that's when we started the first training program of CAHO, which is the basic CPQH. That was a time when the entry-level standards were introduced by NABH. And we decided to start this training program to get the hospitals know the intent of implementation, how to implement these standards in the organizations, because they were depending on paid consultants to be helping them with the implementation. The consultants would tell them how to do. They will get the accreditation certification, but beyond that, the sustainability or how to sustain the accreditation was a problem. That is when we decided that it's time that we build internal capacity in the organizations to make this as a sustainable initiative and people to understand the real intent of the beautiful standards that have been put together by NABH. Kudos and appreciation to NABH, the Quality Council of India, for putting up such pertinent standards and revolutionizing the healthcare delivery system in the country. It is because of these standards today that we see the level of excellence in our healthcare organizations. Now, in order to do that, we needed the capacity to be built because we can't be forever depending on paid consultants to be helping us putting up the implementation in our hospitals. And that is where CAHO played a key role. So our basic CPQH went across the length and breadth of the country. Today, we have more than 5,000 people who have been trained through this training program, the basic CPQH. Now, once the basic CPQH started, we realized that we had to build capacity with full accreditation. And that is when we tied up with the Health Sector Skill Council and announced our first program, the Advanced CPQH. Today, that's a program which is the first upskilling program of the Health Sector Skill Council. And that's almost become like a national quality assurance certification program conducted by Health Sector Skill Council along with CAHO. The professionals are certified by HSSC after examination online, and we have more than 650 people who are trained as advanced CPQH. These are people who are on the ground implementing standards in the hospitals. Now, with the two major programs that we developed, we realized that we needed to build capacity in smaller areas. Let's say verticals. Let's say when it came to infection control practices, we needed to develop capacity with regards to infection control nurses, infection control officers, and what exactly is pertinent, relevant for them to implement, how to develop the modules, how to develop the training programs in their own organizations, how to develop the infection control program for their organization. And that's when we joined hands with some of the industry partners and with the help of experts like Dr. J. Jalakshmi and several other microbiologists and senior members in the country. We developed training programs on hospital infection control, antimicrobial stewardship. We have programs on fire safety. We have on enhanced clinical communication. And today is a very proud day for us as we launch the program on link nurses, on enhancing the capacity of link nurses. Who are these link nurses? What is expected out of them? And today we have an audience of about 110 people undertaking the training program online. And we are very proud to say that we have participants from Sri Lanka and Bangladesh who have joined us. So CAHO understands the need, and as and when a need is understood, there is a gap that is identified, we build capacity, we develop training programs, and we build capacity. Today is also a red letter day because we've just launched a certificate program on biomedical equipment management, because we realized that that's one major area for hospitals when it comes to accreditation, that they have to be calibrated, equipment has to be managed properly, and capacity again is a problem when it comes to this area. So in order to spread the awareness of management of equipment towards the accreditation standards, we developed this program, and that's attended by about 60 participants at Chennai Kaveri hospitals. We are in the process of developing several parallel vertical programs which will help the hospitals to implement the accreditation standards in the country. We have done studies which have shown us the gaps in the hospitals and the benefits the accreditation exercise has brought to our hospitals. And I would share that in the chat box with all our participants. It's a published study by CAHO and the impact of accreditation in the country. We really want to thank and take this moment to thank our accreditation partners in ABH who have done wonders in this country to bring about accreditation ecosystem in the country and have made it extremely pertinent and relevant, very specific to the context and not just a copy-paste exercise from some international standards. Also NABL for the huge role they play in accreditation of the laboratories in the hospitals. It is for us to embark on these standards and make sure that these accreditation exercises benefit the patients we serve. The ultimatum here is to reduce patient safety incidents and to make the healthcare delivery system safe for our patients and also the healthcare providers. CAHO is part of this ecosystem to promote quality in the country, and that's our only role, to promote quality, accreditation, and patient safety in the country. Let me invite all of you to join hands with us as we embark on this wonderful journey to promote quality, patient safety, and accreditation in the country and the region. Thank you once again for this wonderful opportunity given to me, and appreciate all of you for joining us, and appreciate the Quality Professionals Division for putting up such a wonderful program together. Come join CAHO in this great journey, and all of us together can make this healthcare ecosystem safer. Thank you so much.
Thank you, Dr. Lallu Joseph. Thanks a lot for that address to all of us.